Hello, welcome back. We're turning our attention to the United States because the country has said it has recorded 1 million COVID-19 deaths since the start of the pandemic. It's the highest national total in the world. Officials say the number is likely to be even higher. Well, US President Joe Biden made this statement.
This pandemic isn't over. Today, we mark a tragic milestone here in the United States. 1 million COVID deaths, 1 million empty chairs around the family dinner table. Each irreplaceable losses. Each leaving behind a family, a community, forever changed because of this pandemic. My heart goes out to all of those who are struggling, asking themselves, how do I go on without him? How do I go on without her? What will we do without him? It's grief shared by people across all of our nations.
Well, also today, President Biden hosted a global summit on COVID at the White House. The US Health Secretary, Javier Becerra, who went to that summit, spoke to the BBC, and he was asked just what lessons America needs to learn since the pandemic. Here's his answer.
One of the things that we are seeing is the porous nature of our public health system in America. We have black holes where people are falling, and in many cases, as you just mentioned, dying, because our public health system is based on a state-based system. Only in certain cases do we have a national-based system, for example, with seniors and our Medicaid program, which is for those who are low income. But we have people who are falling through the cracks. We can't afford to have that when you have a pandemic. I hope that what we continue to do is strive to have universal coverage on healthcare so that all Americans will know, whether pandemic or not, we will do what we need to do. The other thing, of course, we've learned is that misinformation and disinformation is going to be there from now on. And somehow we have to cut through that and get to the American people and the world the information that is accurate and can save lives.
Well, you might remember that the first US COVID infection was reported in this care home. It's in the state of Seattle, and this was back in January 2020. Now, the man had flown home from Wuhan in China, where, as of course we know, the outbreak began. And you may also remember that shortly after, New York became the epicenter of America's COVID pandemic. Well, from there, my colleague Neda Tawfiq sent this report.
More than 1 million lives cut short across America. This, the only way to visit them now. Laura's father, Alfredo, caught COVID while in a nursing and rehabilitation facility just as the pandemic was ripping through New York. For 3 weeks, he battled to stay alive, but the virus proved too tough an opponent.
My dad is leaning in and holding my hand, just about to blow out our birthday candles.
Laura had to say goodbye wearing a hazmat suit. 2 years later, she says she misses his jokes and pranks and hasn't healed from his sudden death.
I feel like I don't want to, that pretending that he's still kind of around, and because his presence was so ginormous that I still feel it, that it's hard to accept that he's actually not here.
More than 40,000 people have died in this city, the scene of the first major outbreak in the United States. During the scariest months, morgues couldn't keep up with the fatalities. Bodies were buried in mass graves. Nothing ever paralyzed the city in this way.
New York is looking more like its old self, but it hasn't completely recovered. And while it's possible to try and count the death toll from COVID, it's impossible to know how many lives have been forever changed by the loss of a loved one or friend.
This used to be my bed for almost a year during the COVID because I didn't want to get my family sick.
Nurse Flandersha was acutely aware of the risks of her job. It hit home harder after her close colleague Freda Okran became the first nurse to die in New York's public hospitals from COVID. Flandersha says even though COVID cases are now manageable, they are facing another crisis, a shortage of staff.
Supposed to have 2 patients, you're taking care of 5 patients. In an intensive care unit, it's unheard of. I've been a nurse for over 35 years, and I've never, ever seen that in my lifetime.
COVID's tragic legacy will be felt for generations. 1 million dead is an incomprehensible number, but will it be a catalyst for change to prepare the U.S. for the next outbreak? Neda Tawfiq, BBC News.